Hi, my name is Dr. Bram Siegel. I'm Chair of Internal Medicine and Head of Infectious Diseases at Roswell Park Comprehensive Cancer Center in Buffalo, and I'm also a professor of medicine at University at Buffalo School of Medicine. We have two mRNA vaccines, one from Pfizer and one from Moderna. The basic thing is that the mRNA is going to be packaged into a vehicle. It'll be taken up by your own cells, and then that mRNA will be um, used to generate the spike protein. So that's an important protein that the SARS coronavirus 2 uses to attach to human cells. And when this spike protein is made by your own cells after you get the mRNA vaccine, the notion is that your own immune system will recognize it and generate antibodies against it. Is this a new technology? Relatively new. It's been developed for a number of years. It's one of the ways that's been developed is to use as a potential cancer vaccine or as an anti-infective vaccine for viral infection. One of the things that emerged is that when COVID hit us, there was a need to, in essence, the technology had already existed. So it was already existed, and and then when we knew that it was that was a member of the SARS coronavirus family, and we knew how important the spike protein was, in essence, this technology that had been researched for many, many years was further developed and to basically use the technology to deliver RNA that will enable your own cells to make the spike protein. Is there a risk of it changing, affecting one's DNA? No, there's no risk for that. So far it's been well tolerated. The most common side effect is a sore arm. Sometimes people will just feel really fatigued after. That might be worse after the second shot versus the first. Um, More significant side effects are actually very rare. We'll get to them a little bit later, but the most common side effect would be a sore arm and sometimes just feeling really tired. There sometimes could be some muscle aches. You might have some mild flu-like symptoms. No, these side effects are not unique to an mRNA vaccine. Is there any evidence for the vaccine affecting fertility? No. Menstruation? No. Pregnancy? No. A paper just came out in the New England Journal of Medicine where they looked at at pregnant women who received the vaccine, and there was no concern about any adverse safety signal. And this was a substantial number of people who they looked at. Likewise, nursing is fine if you've received the vaccine. There's no reason to not nurse and after you've received the vaccine. The number of cases of myocarditis are really, really small relative to the number of people that have received the vaccine. So you never say that the risk is zero, but as compared to getting COVID, it's not a close call. The vaccine is far safer than a risk of getting COVID. So when we say expedited, it was expedited in terms of enrolling a lot of people because there was a pandemic throughout the world. So what happened is there was a huge investment to try to take the most promising vaccines and enroll a lot of people all over the world. So what happened is within a short period of time, tens of thousands of people were enrolled in these studies. But with that really super large amount of people, you get a very good idea about the efficacy and the safety. So in terms of expedited, it was expedited only in terms of putting in a lot of resources into enrolling people on an international level, but there weren't any safety. There wasn't anything on safety that was compromised. All of the review from a safety standpoint, in terms of the FDA, in terms of the advisors that the FDA uses, all of that was completely done in exactly the way it needed to be done. Now, in terms of long term, since the vaccines were only evaluated in 2020, a legitimate question is, well, we're only in 2021 now, but everything that we show right now in terms of the vaccine is showing a very, very good record for safety. And the CDC and other national and international bodies are actively monitoring any vaccine side effects. So if we see any kind of a signal, such as cases of myocarditis, which may not have been seen in the clinical trials that involve tens of thousands of people, but now when you have tens of millions of people, you may see some cases. All of that is actively being followed and reported. Likewise, the risk for clotting, which again seems to be extremely unlikely, but when you are now have millions of people immunized, even if there is a slight positive uptick, which I'm not sure how real it is, you're going to, this is something that is going to be recognized when you look at the data, and it's reported. Well, no, there's no way I could think it's possible. There's no way I see it as possible because it's not a live virus. Vaccine adverse event reporting system. This is done through the CDC, and it's something that it's not unique to the COVID vaccines. It's for other vaccines as well, where where you report individual adverse events that might occur, and then all of that is looked at in relation to a number of people who have gotten the vaccine, and then people at the CDC and elsewhere will say, is there a potential signal here? In other words, are we seeing these side effects more commonly than we otherwise would have seen in a general population? There is precedent for sure for people to have more than one infection with COVID, and given the frequency now of variant strains that we're facing throughout our country, if you get the vaccine, that gives you that much more protection that you won't be infected with one of the variant strains. So outside of a clinical trial, is the vaccine safe for children? Yes, and I'm now speaking specifically about the Pfizer vaccine because that's the one that has gotten FDA emergency use approval for kids 12 and up, and that's the one where we have the most solid data. The studies are absolutely as rigorous as they've been done as the adults. Now, since children are so low risk, does it make sense to wait? It doesn't make sense to wait because I'm not sure what we would be waiting for. They are a potential reservoir to transmit to others. We want to vaccinate as much of the population as we can. And, one thing of concern is, yes, so far, now I don't want people to think that COVID is benign in kids because it's usually not a big deal in kids, but there are a small proportion, a relatively tiny proportion of small children can have more significant problems associated with COVID. That's in the United States. There's data in Brazil that it is actually that's actually where you have a variant strain where it's much more aggressive in kids, and small children are dying of COVID in Brazil. So does that matter to us in the United States? Well, sure, from a humanitarian standpoint, it certainly does, but keep in mind that these strains are sort of spread on a global level, and I hope I'm wrong, but I think that we have to anticipate from a public health standpoint that there will be additional variant strains that may be more contagious, might be more aggressive, and may cause more significant illness in children. Situations, I mentioned Brazil, but also India, where there's uncontrolled infection, large population densities. It is a threat. I mentioned the potential for variant strains, so that is a big deal. It, some of the variant strains are more contagious. The more contagious the strain, the greater need for herd immunity. In other words, a larger proportion of vaccinated people. Some of the variant strains are more aggressive, and I mentioned the one circulating in Brazil, in which there's a really big problem with childhood mortality. So this is really a different kind of strain that we have to be worried about. You also have immunocompromised patients where, for example, not most patients of cancer, most patients with cancer, for example, will mount very effective immune responses against the vaccine. Some of them, a minority, may not. That doesn't mean that they shouldn't be immunized. They absolutely should, but we have to be just cognizant of the fact that the level of protection from vaccine won't be the same as people with normal immune systems. The vast majority of people should get it, and in my view, don't need to consult a medical professional. And again, most people would, this would be the very, very rare number of people that could have an adverse, some sort of allergic response to some of the stabilizers that are used in the vaccine. If that's the case, the best thing is just discuss it with your doctor, and for a very tiny proportion of people in which there's a concern, they could be referred to an allergist. So experimental gene therapy is totally inaccurate. Gene therapy is totally inaccurate. There's absolutely nothing about these vaccines that modify your genes. It is not gene therapy. In terms of experimental vaccines, so I would use the term investigational. So when the vaccines were being evaluated in 2020, when it goes through different stages of evaluation, phase 1, phase 2, phase 3. The phase 3 are the very large randomized trials. At that point, they're investigational, but then they were proven to be exceptionally effective and safe, and on that basis, they were given FDA approval. And so I would say that of the 3 vaccines that are available in the United States, none of them are experimental. All of them should be viewed as standard as people getting an MMR vaccine or a pneumonia vaccine. And so I wouldn't use the term experimental at all. They've proven to be safe and super effective. And I would, again, highly recommend that people get it. Thanks.